Welcome back. This lecture will cover the first part of the cardiovascular system. There's going to be two parts to this lecture. One is going to cover the heart and one is going to cover circulation. I may be moving circulation into the next unit. So let's start though by taking a closer look at some of the functions of the cardiovascular system. And we're going to look at it as a whole first before we delve into the heart. And there are some pretty important functions, and perhaps the most obvious one is that it's there to circulate and distribute nutrients. So the cardiovascular system evolved as a solution to deal with problems of diffusion. So a single-celled organism or even a small multicellular organism doesn't really need a way to move material around because it can use diffusion. But once larger multicellular organisms began to evolve with more specialized tissues, it became a bigger problem. So the circulatory systems with and without pumps evolved to deal with distributing nutrients like oxygen or glucose. And it's also equally important to be able to remove waste, which is another function of the cardiovascular system. Also being circulated around the body are chemicals involved in communication. So there are hormones that are released within the blood and other proteins that allow for the body to communicate. And the cardiovascular system also plays a role in the regulation of body temperature and muscle activity. So it does this by constricting or dilating vessels. So when you start to exercise, for example, and you're going up the stairs, you're going to engage your quads. And you will get an increase in blood supply to the muscles that need it the most. And similarly, in terms of temperature, if you step outside on a cold day, you're going to get constriction of blood vessels in the skin so that the blood doesn't cool off and head back towards the heart, because if it's cold, it could then lower your core body temperature. And then finally, the cardiovascular system is in partnership with your lymphatic system as well as your immune system to distribute, for instance, antibodies in case of an infection, or circulate white blood cells to deal with pathogens or infections. Also to distribute platelets to stop bleeding. So there's lots of functions here, and you are actually going to cover a lot of these functions in greater detail when you take a physiology course. All right, so today our focus is going to be on the heart. We will look at circulation in the next lecture, but we are going to talk about the pump. So we have what's called a closed circulatory system, and that means that all of our blood, which includes red blood cells, white blood cells, platelets, and of course the plasma, is all contained within vessels. This image is showing you an anterior view of the heart as well as a posterior view of the heart. And the heart consists of 4 chambers. There are 2 smaller upper chambers, which is the right atrium and the left atrium, and 2 larger bottom chambers, which are the right ventricle and the left ventricle. The heart is tilted a little bit and also rotated. I'll show you that more in the next slide. So because it is rotated a little bit, when you're looking at the anterior surface of the heart, you can see most of the right ventricle and only a little bit of the left ventricle, okay? and you can see the two upper chambers. We will talk more about the greater vessels of the heart, which are all the vessels here at the top that are coming off of the heart. We'll touch on it a little bit today, but we'll talk more extensively about it when we talk about circulation and we go over all of the named vessels. All right, let's now look at a posterior view of the heart. So again, you can make out those two smaller upper chambers, the right atrium, and now you can see more of the left atrium. And when you see the posterior side, you can see the majority now of the left ventricle and a little bit here of the right ventricle. So I just want to star this view so that you can see that when you're looking at the anterior side of the heart, because of its rotation, the majority of what you're looking at is the right ventricle. All right, so let's talk a little bit more about this position and orientation that I've been alluding to. So the heart is about the size of your fist. So if you clench your hand, that fist, that is the size of a normal, typical heart. And it is, I still don't know why my iPad does that. It is positioned here in the chest. Again, as we've talked about before, it's located in the mediastinum, which is also located in the thoracic cavity. It sits above the diaphragm as well as the lungs. You can see the apex. So the apex is the tip of the heart right there. So again, it is tilted leftward. So your heart sits a little bit left of center. It's not right in the center, it's more left. And it has a rotation to it, which is what is allowing you to see most of the right ventricle. So the left ventricle gets a little bit hidden because of that rotation. And here it is showing you the base of the heart, and then those larger vessels are going to come off of that base of the heart, exit the heart, and then we'll discuss where those vessels are going. All right, so let's talk about the vessels that are involved with the heart. It is important to understand the definition of arteries and veins. So I'm going to go over that right now. So arteries are defined by the fact that they are transporting blood away from the heart. So a popular but wrong definition is that arteries are carrying oxygenated blood. And that is only true for one of the circuits. And I'm going to show you that more on the next slide. But we have two circuits that the heart is circulating blood to. One is called the pulmonary circuit, and one is called the systemic circuit. So half of the heart, part of the heart, is sending blood to the lungs and back. That's what's called the pulmonary circuit. And then the other side of the heart is distributing that blood to the rest of the body. And that's what we call the systemic circuit. And again, I have that on the next slide for you to see. So be very careful with your definitions of arteries and veins. So on the other hand, veins are defined by the fact that they are transporting blood toward the heart, okay? And then capillaries, these are the smallest of the vessels. These are what are going to interconnect arteries and veins. And we're going to talk a lot about this in the next lecture. But capillaries are where all of the exchange of nutrients or gases occurs. So that's what's happening in the capillaries. All right, this next slide demonstrates the differences between the systemic circuit and the pulmonary circuit. So on models and diagrams and anywhere that you're looking to see arteries and veins, you're normally going to see arteries in red and veins in blue. Now, in the systemic system, the arteries are going to contain oxygen-rich blood, but we're not going to use that as a definition. And veins are going to carry oxygen-poor blood. And the reason for this, which is what I've been talking about, is what's happening with the pulmonary circuit. And this often confuses students. So we'll try and keep talking about this topic so that you get comfortable with it. But when we're talking about the pulmonary circuit, so again, part of the heart is sending blood to the lungs. So what you're going to see is that the pulmonary artery that is sending blood from the heart to the lungs is going to be pictured in blue, okay, not red. And the pulmonary vein, which is bringing blood back from the lungs to the heart, are going to be pictured in red. So this is the opposite of all the other arteries and veins in the body. And in this instance, the pulmonary artery is going to carry oxygen-poor blood to the lungs, and then it's going to get oxygenated in the lungs, and the pulmonary veins are going to bring oxygen-rich blood back to the heart so that it can then circulate throughout the whole body. So again, normally arteries are going to be red and they're going to carry oxygenated blood, and veins are going to be depicted in blue and they're going to carry oxygen-poor blood, except for the pulmonary circuit. That is going to be the opposite. All right, before we get into circulation and how blood is flowing through the heart, we do need to talk about some other topics. And one of these you've seen a little bit about, but we've talked a little bit about this before, where we've talked about the serous membranes that cover the heart. But we're going to revisit that and go into just a little bit more detail about that. All right, so let's start with the outermost layer that covers the heart is called the fibrous pericardium. This is the outermost, the superficial layer that's covering the heart. And you don't typically see this because it's typically removed on the cadaver heart. And it's also typically removed when we do the sheep dissection. So you're not going to see this. But this is a very tough outer layer, a fibrous layer. It's almost, you can think of it like duct tape. It protects and anchors the heart to surrounding structures. And it also prevents it from overfilling so that the heart cannot expand further than this fibrous pericardium. It's kind of like the walls of a classroom. So again, that is the tough outer layer that you're going to see. And then below that, you're going to see this serous membranes. And I'm going to talk more about these serous membranes on the next slide, but you probably remember them from the very first lecture. We talked about the parietal pericardium and the visceral pericardium. And then in between the two, there is serous fluid, okay? So this pericardium, as I was explaining, is going to prevent displacement of the heart. It's going to keep it within the walls of that pericardium. So it's going to act as a physical barrier. It's going to protect it from getting infected from pathogens or anything that shouldn't be there, from inflammation. And then there's also some pain receptors and some mechanoreceptors, as we've talked about when we were talking about when we had our sensory lecture. Okay, so this is going to help monitor what's happening in the heart. All right, So here we're taking a closer look at these layers that I've just been talking about. So we're taking a little section through the heart and then we're blowing it up so we can really see what these layers are all about. So this is what it's showing you, the pericardium and what makes up the pericardium. So again, we have the parietal pericardium. We just talked about that dense fibrous layer. And then underneath that you have some areolar connective tissue and you have a simple squamous epithelium. That is what's making up that parietal pericardium. And then in between here, there's some serous fluid. Now let's look at the visceral pericardium. So we're right here. And another term for visceral pericardium is called the epicardium. That's the epicardium, the outer layer, if you will, of the heart. And you're going to get another layer of simple squamous epithelial cells and some more connective tissue. All right, and then the heart itself is made up of, remember those cardiac cells? We looked at them under the microscope, cardiac cells, and they have those intercalated discs. You can see those intercalated discs here. Another term, the more proper term or anatomical term, is that these cells are the myocardium. Those are the cells that make up the heart. Those are myocardiocytes. I completely said that wrong. My apologies. I don't know if my brain is working correctly tonight or not. Cardiomyocytes. I knew when I said it there was something wrong with it. Cardiomyocytes. Those are those heart cells, the cardiac cells. And then the innermost layer, the deepest layer, is called the endocardium, okay? And there is another layer of epithelial tissue and more areolar connective tissue, right? And this is what's facing the inside of the chamber so that that's where the blood is flowing. Whenever you have cells that are close to blood, you usually call it an endothelium, okay? I have all this written out on this next slide here to again talk about the layers of the heart. So we talked about the epicardium, that is the external surface, and that consists of the visceral pericardium. Remember, that was another name for that. Then we have the myocardium. That's where we found those cardiomyocytes. Those are the cardiac cells that you looked at under the microscope. Remember, they had those intercalated discs. There was also some connective tissue. There's going to be blood vessels and nerves in that myocardial layer too. And then the innermost layer is called the endocardium. And that is where the endothelial cells are, that is facing the inside of the chamber. I have one other picture that I really liked. Oh, the color transferred really weird. I also don't know why it does that. But anyway, you're still going to get the idea. So here is the heart here. A nice big chunk of the heart is being taken out so that you can see these layers a little clearer. So you can see the epicardium, that's the outermost layer, also called the visceral pericardium. Here's the myocardium, that's where those cardiomyocytes are. And then the endocardium, that's the inner layer. And you can see how that inner layer is facing inside the chamber. All right, so let's talk about these circuits. This is a really good picture showing you these different circuits and how the heart is considered to be a double pump because we have two different circuits going on. So we have the systemic circuit, which is what I told you about, and that has to do with the left side of the heart. So the left side of the heart is going to be what is pumping blood to the rest of the body. And then we have the pulmonary circuit, which is the right side of the heart. So the right side of the heart is going to be pumping to the lungs. Now, I already mentioned that the atria were the two top chambers. They are the two smaller chambers. They are going to be receiving blood from both the pulmonary and systemic circuits. And then the ventricles, the two lower chambers, they are the ones that are going to be pumping the blood. Let me give you a brief overview of how the blood is going to be pumping. And I've got more pictures and more time to show you this, but let me just do a brief rundown. So all of the organs, all of the tissues, and I'm going to start on this side. There's no better place to start. After all of the tissues, everywhere in our body has utilized the blood, okay? And it needs to make its way back to the heart because it has been depleted of oxygen. So we're going to call it oxygen poor blood. All the blood is now draining back to the heart from tissues that have taken out the oxygen. So this oxygen poor blood is going to make its way back to the heart. It's going to enter the right atrium, and then it's going to go into the right ventricle. From there, it is going to make its way back to the lungs because that is where we get our oxygen. We get oxygen from breathing, and so that blood is going to make its way back to the lungs. It's going to get oxygenated. So oxygen-rich blood will leave the lungs. It will come back to the heart on the left side. It will enter the left atrium, the left ventricle, and then it will be pumped throughout the rest of our body. And then it will head to all of the tissues and all of the organs again to provide oxygen to it. And then as the tissues deplete that oxygen, we will then restart the circuit. And that blood will then head back to the heart to go back to the lungs and then start all over again. So let's continue to examine how blood is flowing through the heart. My apologies on this. This is again a PDF transfer with airdropping. You guys are going to have to let me know if you have this problem, or maybe it's because I airdropped a PowerPoint instead of a PDF. All right, I'm going to try it the other way around. All right, so again, the atria are on the top here. These are the two atria, and they're going to be receiving blood. And the atria have small, thinner walls compared to the ventricles. You can kind of see that. You can see the size of the wall here is much thinner in the atria compared to the ventricles. So the right atrium, which is right here, is going to receive blood from the body. And the left atrium is going to receive blood from the lungs. So let me write on here that this is the right side and this is the left side. All right, and then I think what I'm going to do is I'm going to stop this and I'm going to try to fix this slide and then merge my videos together. All right, let's continue. I think I fixed my PDF. Let's continue our discussion about the internal anatomy of the heart. Specifically, we're talking about the chambers of the heart. So let me orient you and put on this side, this is the right side of the heart. This is the left side of the heart. The atria are the two top chambers. They are going to be receiving blood. They are smaller and thin-walled. The right atrium receives blood from the body. The left atrium receives blood from the lungs. Geez, I can't talk today. in between, and it's kind of hard to see because of this pulmonary artery right there, but in between the atria is something called an interatrial septum. Okay, so that's separating the walls of the left and the right atria. The ventricles are below. They are much bigger. They are going to be pumping blood out, so they tend to be a little bit more muscular. The right ventricle is going to pump blood to the lungs, and the left ventricle is going to pump blood to the rest of the body. And you can see that there is also a septum between the two ventricles, and that is called the interventricular septum. Let's take a closer look at the atria. Again, these are the receiving chambers. They contain something called auricles. And auricles kind of like remind you of the ear, the outside portion of the ear, hence its name. These appendages allow for an increased amount of atrial blood that can be contained within the atria. These are small and thinner walled. They do contain a muscle called the pectinate muscle that does help with pumping. Let me show you the pectinate muscle. Those are what these ridges are right here and right here. You can see them nicely on models as well. Those are the pectinate muscle. They do not contribute a whole lot to propulsion of blood. So blood from the atria will enter the ventricle mostly through gravity. There's a little bit of movement from the atria. And there are 3 veins that empty into the right atrium. So you have the superior and inferior vena cava. Let me show you those. So here, I'm going to change my color. Here is the superior vena cava. That is going to drain blood from the head and the neck region. And then you have the inferior vena cava, which will drain blood from the lower regions of the body. There's also something called the coronary sinus, which we're going to talk about later, but I don't want you to forget that there are 3 vessels that empty into the right atrium. The coronary sinus has to do with the coronary blood supply that the heart is going to be receiving, which again, I'll talk about a little bit later in the talk. But there are 3 vessels that empty blood into the right atrium. There are 4 pulmonary veins that empty into the left atrium. So here are the pulmonary veins. Here's 1, here's 2, here's 3, and here's 4. Okay, and they are all going to dump blood into the left atrium. Okay, let us talk about something that's somewhat clinically significant, and that has to do with the interatrial septum that I mentioned to you. So again, that septum separates the atria, and interestingly, during fetal development, there is a hole there called the foramen ovale, okay? Because, as I just got done telling you, that one of the pathways is going to the lungs and back. But when you are a fetus in the womb, mom is giving you all of these nutrients. And that's happening through the umbilicus. So your lungs have never been inflated. So there's no reason to send blood to the lungs. So again, the right ventricle normally sends blood to the lungs through the pulmonary artery, but we don't need this to do that. So we bypass the lungs, and this bypass happens at the foramen ovale, so that blood can go through the right atrium and the left ventricle, and then to the rest of the body. So what's happening is that after birth, that hole needs to close up. So as soon as you take your first breath after being delivered, that hole closes and becomes scar tissue. And that scar tissue is called the fossa ovalis. And you can see the fossa ovalis on many of the heart models that we have in the lab. So again, it starts out as a hole, the foramen ovale, and then it closes up. But something interesting can happen, and it happens in, I would say, up to 20% of individuals, and that is something called a patent foramen ovale. And what that is that hole actually stays open after birth and into your lifetime. And you may actually never know about it. So what's happening is now you're mixing oxygen-rich blood with oxygen-poor blood, and you wouldn't know it. You can live into adulthood almost. But the problem is if it goes undetected, which sometimes it does, and this actually happened to an instructor here at MiraCosta, was that when you have mixing of blood like that, you can get a clot formed. And the clot had traveled from his heart down to his lower leg and then back up to his brain, and he had a stroke. So it's very serious. Luckily, everything turned out okay and he's doing fine. But this is something that can happen if left untreated. Okay, so we just talked about the left and the right atria being separated by the intra-atrial septum. I also mentioned that the ventricles have a septum called the interventricular septum. And you can see that nicely here in this picture. Here's the interventricular septum. Again, this is the left side. This is the right side of the heart. And we're going to start talking about the valves. So there are 4 valves in total. There are valves that separate the atria from the ventricles, and they are named atrioventricular valves. But before I go on to tell you about those valves, I want to spend a little bit more time talking about what the anatomy of the ventricles look like, and then we'll move on to the valves. All right, so the ventricles are the bottom chambers, and they are the ones pumping the blood. So they actually contain or hold most of the volume of the blood. And again, to orient yourself, this is the right side and this is the left side. The right ventricle, if you remember from the very first slide, is the ventricle that you see the most of in its anatomical, when it's positioned correctly in the body, because it's rotated a little bit. So you see the right ventricle the most. However, the left ventricle, and this is one way to orient the heart anytime you're looking at the heart, whether it's a model, whether it's the dissection, when we do the dissection of the heart, the one telltale sign is that the left ventricle is 3 times thicker than the right. So the left ventricle is 3 times thicker. And this is because it is exerting more pumping force because it has to pump blood to the entire body. So the musculature around this ventricle is very, very thick. And it tends to flatten the right ventricle a little bit into what looks like a crescent shape. And you can also see muscle ridges in the ventricles, just like you could in the atria. And it is called the trabeculae carneae. Sorry, I have a helicopter flying above me. Trabeculae carneae. Okay, that is the muscle around the ventricles, and that is what is going to help with pumping. All right, let's take a closer look at these valves. So again, I had mentioned that there are 4 valves, And this is to ensure that blood is always flowing in a one-way direction. We never want blood to flow in a backwards direction, or this would be called regurgitation of blood. And that would actually create a heart murmur. So there are atrioventricular valves. So these are valves that are controlling blood flow from the atria to the ventricles. They are called atrioventricular valves. And more specifically, there is what's called a tricuspid valve and a bicuspid valve. All right. Unfortunately, the bicuspid valve also has another term that's used more often in the clinic, and it's called the mitral valve. So this is also called the bicuspid valve. Most clinicians call it the mitral valve. And I have a cute little mnemonic, or not mnemonic, but a way to memorize this. I learned from a video that I watched. If you have a hard time memorizing the valves, you want to try before you buy. So the tricuspid is on the right side. The bicuspid is on the left side. It is important, though, since you are going to be entering the clinical field, to understand that there are other terms. So they are called the atrioventricular valves as a group. And then the tricuspid is on the right side, and the bicuspid or mitral valve is on the left side. These two atrioventricular valves have a certain appearance to them and some other terminology and anatomy associated with them, so I'm going to talk about them a little bit more. But I also want to introduce the other valves of the heart, which are leading out of the ventricles, and they are called the pulmonary and the aortic valve. And it kind of tells you which one is which because it is the vessel in which it is headed towards. So this is the pulmonary valve right here because that is the pulmonary artery. The blood is headed towards the lungs. And then on this side is the aortic valve because the blood is headed up toward the aorta to go to the rest of the body. They are also called semilunar valves because of their appearance. So let me show you what these valves look like so you can see why they were named the way they are. All right, so this is like taking a transverse section, so like taking off the top portion of the heart and looking down at the valves so you can see what they look like and why, and it kind of tells you why they were named that way. So here is the tricuspid valve right here, and here is the bicuspid valve, okay? So you can see they have these cusp appearances, and there's 3 cusps that form the tricuspid valve, and then there's 2 cusps that form the bicuspid valve or the mitral valve. And then the aortic and semilunar valves, these also have a little bit of a different appearance. They have more of like a cup, like they look like cups that are going to fill up. And that's actually exactly how they're going to operate. So let me take some time and show you a little bit more about the atrioventricular valves and how they work. All right, so let's look at the atrioventricular valve mechanics. All right, so here is an example. We're looking at the bicuspid valve or the mitral valve. Again, these valves are going to ensure that there is one-way flow of blood. We don't want blood flowing backwards, okay? So these valves will open when the ventricle is filling, and then they will close when the heart is getting ready to pump. Now, I kind of think of these, they're a little bit flimsy. these valves, if you will. So they need mechanisms to kind of hold them in place. And what they have are something called chordae tendineae. That's what these are. That's what these strings here, all of these strings are holding on to the valve. And you've probably heard of the term heartstrings. Somebody's pulling on your heartstrings. That's what they're referring to. Those are the chordae tendineae. They are collagen cords, and they are attached to the valves to kind of hold them down. So kind of think of this like, if you have an umbrella when it's really, really windy out, and if the wind catches it just right, the whole umbrella will go backwards. These strings are preventing that valve from doing exactly that. And those strings are attached to a muscle, which you can see really well during dissection, called the papillary muscle. These are going to protrude out. They're rather large. They're protruding from the ventricle wall, and they are attaching to the chordae tendineae to make sure that that valve doesn't flow up this way, and then blood would then eventually escape. These features can only be seen with the atrioventricular valves, and it's because of the design of these valves that we have these extra steps in place. The semilunar valves do not operate this way, though. So I think I'm going to tell you what this slide is about, but you can see these, here's the pulmonary valve, here's the aortic valve. They look like little cups. You can actually see it better here in this picture. So what happens is if blood does decide to flow backwards, these little cups fill up, and that slams the valve, like the door, if you will, shut, so that blood cannot re-enter the ventricle. So it almost has a built-in mechanism to ensure that these valves will close. Now, there are sounds that the heart makes, okay? And when you're listening to the heart, the first sound that you will hear, the first heart sound, that lub sound, that is the sound of those atrioventricular valves closing. That's when that tricuspid and bicuspid valves close. It produces a heart sound. The other sound that you hear, the dub, so lub dub, the dub sound occurs when the aortic and pulmonary valves close. So there's two heart sounds that come from the closing of the valves. All right, now that we've talked about the internal anatomy of the heart, we've talked about the valves, we can go into a little bit more detail about the greater vessels of the heart. And we will continue to talk about these greater vessels as we move into the next lecture, which has to do with circulation. And then we're going to follow blood from the heart to all the different regions of the body. But I think it's good to have an introduction to some of these vessels now, but we're going to continue to revisit them. All right, so let's talk about a little bit more about how blood is flowing. So as I mentioned, you had the inferior and superior vena cava. So blood is draining from the head, neck, shoulder area. It's already been used, and it has to go back to the heart. The lower body is going to drain into the inferior vena cava. And that blood is then going to head into the right atrium. It's going to pass the tricuspid valve and enter into the right ventricle. From there, it's going to pass the pulmonary valve, and it's going to go to the pulmonary artery and head toward the lungs, okay? So it's going to head towards the lungs to get oxygenated. The blood will then arrive back from the lungs, now that it is oxygenated, through the pulmonary veins. and there's 4 of them, okay? They're going to arrive through the pulmonary veins, and they are going to enter the left atrium. The blood will pass through that mitral valve into the left atrium. The blood will then pass through the aortic valve and head up towards the aorta, and then it will head to the rest of the body. Now, there are terms for all the names of these vessels right here coming off of the aorta. We will talk more about that when we talk about circulation. I do have a little nifty video that I can show you on how to memorize the flow of blood in and out of the heart. You must be able to know exactly how it's flowing, pretty much how I just said it, and know all the valves, all the valves of the heart, which ones it's passing as well. All right, so we just talked about these 5 greater vessels. I just introduced you to them. You have the superior vena cava, the inferior vena cava. We talked about the pulmonary artery, then heads to the lungs and comes back to the pulmonary veins, and then out the aorta. So you can also use this to follow deoxygenated versus oxygenated blood in and out of the heart. But we have a lot of other topics to discuss, so you just kind of have to sit down and work through this blood flow if you're not familiar with it. And I'll probably try to post a supplemental video on how to remember all of these areas. All right, this next, I actually thought I took this out, but this next picture is showing you the names of the arteries that are coming off of the aortic arch. I do have, I don't know if it's a mnemonic, but it's called, and I'm going to revisit this in circulation, so I don't want to spend too much time with this. It's called, somebody told me this, a clinician actually told me how to remember this. You use the ABCs. A is for aortic, B is for brachiocephalic, C is for the left common carotid, and the S is for the left subclavian. Again, we're going to revisit that, but as a whole, now you have been introduced to the aortic arch. The vessels, all of the named vessels, will become clearer when we talk about circulation in the next lecture. So I want to move on because we still have a lot to talk about. I want to move on to the coronary blood vessels of the heart. So the heart tissue itself needs a blood supply. So a common theme that we've talked about, I feel like, is this idea of diffusion. So we can use diffusion if we only have cells that are in a couple cell layers, they're a couple cell layers thick. But when we have a large tissue or organ like the heart, we can't rely on diffusion for all of the heart tissue to get its nutrients and oxygen. So some of the heart, like the inside of the chambers, is being exposed to blood, but the tissue on the outside is not being exposed to blood, and it still needs oxygen and nutrients. So the heart actually has, just like every other organ in the body, has its own blood supply. And that is what's referred to as the coronary blood vessels. So these are blood vessels that are providing blood to the tissue. So they are going to supply cardiac muscle tissue via the coronary circulation. And there are a series of named arteries that surround the heart and provide the heart with blood. All right, so the 2 major ones are called the coronary arteries. There is a right coronary artery and a left coronary artery. And they, of course, branch into other arteries and follow along the heart wall to provide blood to them, to that area. let me show you a view of the coronary circulation. All right, so first let's orient ourselves. This is the anterior surface of the heart. We are seeing mostly the right ventricle, a little bit of the left ventricle. We can make out the right atrium. It's very hard to see the left atrium, but you can still see it. All right, so the first thing to do is notice that there is a right coronary artery. So this is, of course, the right side of the heart. This is the left side of the heart. And both the left and right coronary artery are emerging from the aortic arch. This is blood now that's being distributed to the rest of the body, so it is oxygenated. Off of the aortic arch, comes the right coronary artery and the left coronary artery. All right, and these are going to supply blood to the ventricles. So you can see the right coronary artery traveling down this way and the left coronary artery. The left coronary artery branches into what's called the circumflex artery. All right, circumflex meaning like going around, because it's going to kind of loop around here. And then another major division off of the left coronary artery is something called the anterior interventricular branch. All right, this anterior interventricular artery is going to branch down and is going to come down and provide blood to the ventricles. There are actually many arteries and veins that provide blood to the heart and then return that used blood, but I'm trying to pick out the major ones for you to memorize, but we will, of course, not go over all of them. So I'm trying to box the ones that I want you to know. So again, if we come back here, the right coronary artery, and you can't see this until I show you a posterior view, is going to branch into the posterior intraventricular artery. It is called this because it is running down that intraventricular septum area. That's why it's called that. But what I did show you was the left coronary artery branched into the circumflex artery. That's going to kind of go around the back. And then there was an anterior intraventricular branch. It's also called the LAD in the clinic. Why they all have numerous names, I can't help you there. I am just the messenger on this. But clinically, this is sometimes called the left anterior descending artery, I think it is. I'd have to look it up. I honestly forget. Okay, so that's the anterior view. Here is the posterior view, and then I'll come back and talk about the veins. So you can see the posterior interventricular branch running down the posterior side. All right, so those are the named arteries. You can also see that circumflex artery headed towards around the corner as well. All right, I wanted to make sure that I had veins listed here. The veins that I want you to know are on the next slide, so we'll revisit these pictures, but let me read you the ones that I want you to know. And this is when we're going to come back to this coronary sinus that I mentioned at the beginning. So these coronary veins are then going to drain the blood from the heart after it's been utilized and the oxygen and nutrients have been taken up. And ultimately, all of this blood that has been utilized is going to make its way back to the coronary sinus. And do we remember where the coronary sinus dumps? Because this is now used blood. It's all the oxygen's been depleted and the nutrients have been depleted, so it needs to get back to the lungs. So it is going to drain into the right atrium, just as the superior and inferior vena cava drained into the right atrium. All right, so the major veins that I want you to know are the great cardiac veins and the middle cardiac veins. So let me take you to the anterior view of the heart. You can see the great cardiac vein here. And here we see the middle cardiac vein. And again, all of these veins, here's that great cardiac vein again, all of them are going to lead to what's called the coronary sinus. So again, I tried to pick the major veins and arteries that are supplying blood to the heart and then returning it so that you don't have a whole lot to memorize, but at least you have the basic knowledge of what is providing blood to the heart. I have a really great picture because we've been alluding to this idea of this coronary sinus. So this picture has the atria kind of cut open, so you can see how that coronary sinus is then going to drain into the right atrium. Okay? So it is critical that you understand that. Again, these veins, they're carrying carbon dioxide because they've gotten rid of oxygen. They're carrying waste, and that is what's going to empty into that coronary sinus. And then that material, that blood, will head back towards the lungs. And to prevent this lecture from getting too long, I just want to tell you that some of the slides that I inserted next, I think I found in your textbook, that go over blood flow. So if you're having a hard time understanding how blood is flowing through the heart, these pictures give a nice presentation of how that blood is moving, starting with the superior and inferior vena cava, going to the right atrium, and it kind of just starts to show you how it's moving through the entire system. And then you end up with oxygenated blood. So it's not necessarily that I want to go over all of this. I have just provided, and here is another image that is actually numbered and labeled so that you can start to memorize and have a very good understanding of how blood is flowing to and from the heart. So if you need these images, I put them here for you, okay? A couple other last topics before we end this lecture. One of them has to do with how the heart sets its rhythm. So we know that the heart is beating, it beats anywhere from 70 to 80 beats per minute. It has something called diastole and systole. Diastole is when there's an expansion. Systole is during contraction, so there's a constant movement between the two. And I think I also told you that all of the cells have to contract at the same time. They have this intrinsic ability to contract. And to set the pace of the heart, there is what's called a sinoatrial node, or an SA node. You can see it here. And this is the place that is going to adjust and tell all the other cells in the heart when to beat. So it's called the pacemaker because it is setting the pace of the heart. It is a specific region located in the heart, and it's actually connected to the nervous system so that your heart knows, and all of the cells within the heart know exactly when to beat. That is the sinoatrial node. Lastly, we will wrap this lecture up by talking about a few clinical disorders or diseases that occur in the heart. So I'm sure you've heard of coronary artery disease. There are a few definitions or terms here that are important. There's atherosclerosis, and I'm actually going to talk a little bit about that and how that has to do with a heart attack. That has to do with fatty deposits building up. It could be, because of a poor diet or too much fat in your diet. The term angina pectoris is referring to chest pain. Myocardial infarction is referring to a blocked coronary artery. Remember, those are the arteries that are supplying blood to the heart. Again, I'm going to talk about these two on the next couple slides. And then another term you'll sometimes hear is called silent ischemia. This is a heart attack with no pain or any warning. This is not where you grab your chest or your arm is hurting, where the pain is kind of moving around, down your arm. This is completely silent. You have no idea. So let's talk a little bit about this idea of atherosclerosis and how fatty deposits can cause coronary artery disease. So this is a nice image showing you a normal artery and all the red blood cells flowing through that artery. When you get plaque buildup, and this is of course why you get your blood drawn and your cholesterol read. So if you have too much of this cholesterol or lipid or fat, it starts to build up in these arteries and it causes the flow of blood to slow down. So you're not getting a lot of blood flow there. Then what can happen in a more serious situation is you can get plaque buildup with a blood clot forming around it. At this point, you're not getting any blood flow through that artery. And what happens, and a lot of times it happens with this anterior interventricular artery, is that you will lose blood flow to that artery that is supplying those ventricles with blood. Oh, here's the LAD, the left anterior descending artery. I think I said it right then. So that's a common culprit to coronary artery disease. What happens is once you lose blood flow, all of those cardiac cells start to die, okay? And they no longer have the ability to pump because they are losing oxygen and nutrients, and you do not have a lot of time from when that happens. But one thing that you can do, and this is a really cool procedure, where they can insert a balloon or a stent. They can actually follow the femoral artery, the artery in your leg, all the way back up to your heart. They can find that artery that is blocked, put that stent in there, and then open it up. And that would then allow blood to flow back to that heart. And this is a really cool image. So it's showing you that coronary artery before they put the stent in. So you can see here there is no blood flow, and then you can get a restoration of blood flow. But this really has to be caught right away, or it can be quite deadly. I think the rest of the slides have to do with the anatomy of the heart that we're going to dissect. I'm not actually going to go over that. We'll do that in lab, but you have those images to work off of. Plus, I'll put a video on how to do the dissection. So this concludes the lecture on the heart. Our next lecture, which again may be pushed into the next unit, has to do with identifying all the arteries and the veins in our body so that we can follow blood flow from the heart to the rest of our body. All right, I shall see you in lab.